Zepzelca 4 mg intravenous solution is a medication used to treat lung cancer. It belongs to a class of drugs known as alkylating agents, and it works by slowing or stopping the growth of cancer cells. The recommended dosage of Zepzelca is 3.2 mg per square meter administered as an intravenous infusion over 60 minutes on day 1 of a 21-day cycle until disease progression or unacceptable toxicity. It is important to take this medication at the same time each day to maintain a consistent level in your body. Before starting the treatment, make sure to consult the patient information leaflet provided by your pharmacist. Zepzelca 4 mg intravenous solution alkylating agents is administered through an injection into a vein every 21 days, usually over a 60-minute period by a healthcare professional. The dosage of this medication is determined based on your medical condition, body size, response to treatment, lab tests, and other medications you may be taking. Your doctor may also prescribe additional medications to prevent side effects such as nausea and vomiting, so be sure to follow their directions carefully. It's important to inform your doctor and pharmacist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. Additionally, it is recommended to avoid consuming grapefruit or Seville oranges while using this medication, as they can increase the chance of side effects. To ensure you get the most benefit from this medication, it's crucial not to miss any doses. You can mark the days on your calendar when you need to receive this medication to help you remember. If you experience tiredness, joint pain, constipation, diarrhea, abdominal pain, nausea, vomiting, or loss of appetite while using Zepzelca 4 mg intravenous solution alkylating agents, it's important to let your doctor know. They may be able to prescribe medication to help with these symptoms. Additionally, eating small meals, avoiding eating before treatment, or limiting your activity may help lessen these effects. It's important to note that while using this medication, you may experience serious side effects. However, your doctor has prescribed this drug because they believe the benefits outweigh the risks. Your doctor will carefully monitor you to minimize any potential risks. If you experience any serious side effects, such as pain, redness, or swelling at the injection site, easy bruising or bleeding, numbness, tingling, or pain in the arms or legs, pale skin, muscle pain or weakness, or signs of liver problems, it's important to contact your doctor right away. Additionally, this medication may lower your ability to fight infections, so it's important to be mindful of any signs of infection and report them to your doctor promptly. While rare, a serious allergic reaction to this drug is possible. If you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing, seek medical help immediately. It's important to remember that this is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. Before starting Zepzelca 4 mg intravenous solution alkylating agents, it's important to let your doctor know if you have any allergies to medications, as this product may contain inactive ingredients that could cause allergic reactions. Additionally, inform your doctor about your medical history, especially if you have had recent or current infections, kidney problems, or liver problems. While using Zepzelca, you may be more susceptible to infections or your current infections may worsen. It's essential to avoid contact with anyone who has a contagious infection, such as chickenpox, COVID-19, measles, or the flu. If you have been exposed to an infection, be sure to consult your doctor for further guidance. Prior to receiving any immunizations or vaccinations, it's crucial to notify your healthcare professional that you are using Zepzelca. Also, it's important to avoid contact with individuals who have recently received live vaccines, such as the flu vaccine inhaled through the nose. To reduce the risk of injury, exercise caution with sharp objects and avoid activities that may result in cuts or bruises. Before undergoing any surgical procedures, it's important to inform your doctor or dentist about all the medications and herbal products you are using. Older adults may be at a higher risk for low blood cell counts while using Zepzelca. If you are pregnant or planning to become pregnant, it's crucial to discuss this with your doctor, as Zepzelca may harm an unborn baby. Pregnancy tests may be ordered before starting this medication, and reliable forms of birth control should be used during treatment and for a period after the last dose. For men using this medication, reliable forms of birth control should also be discussed with a healthcare professional. It is not recommended to breastfeed while using Zepzelca, and consultation with a doctor is advised before breastfeeding. It's important to be aware of potential drug interactions with Zepzelca 4 mg intravenous solution alkylating agents. These interactions can affect how the medication works or increase the risk of serious side effects. Make sure to keep a list of all the products you use, including prescription/non-prescription drugs and herbal products, and share it with your doctor and pharmacist. It's essential to not start, stop, or change the dosage of any medicines without your doctor's approval. Certain medications can also impact the removal of Zepzelca from your body, which may affect its effectiveness. Examples of these medications include azole antifungals, macrolide antibiotics, HIV drugs, rifamycins, ritonavir, St. John's wort, and some drugs used to treat seizures. Be sure to discuss any potential interactions with your healthcare provider. If you or someone else has taken too much Zepzelca and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek immediate medical help by calling 911. You can also contact a poison control center for guidance on what to do next. In the U.S., you can reach your local poison control center at 1-800-222-1222, and in Canada, you can call a provincial poison control center. Before starting Zepzelca 4 mg intravenous solution alkylating agents, it is important to undergo lab and/or medical tests including complete blood count, kidney/liver function, blood sugar, and sodium/magnesium blood levels. These tests should also be continued while using this medication. It is crucial to keep all medical and lab appointments. It's crucial to take each dose of Zepzelca 4 mg intravenous solution alkylating agents as directed by your doctor. If you happen to miss a dose, be sure to consult with your doctor or pharmacist to establish a new dosing schedule. This medication is administered in a medical facility and is not meant to be stored at home. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.